Welcome back. In the chapter of preventive medicine and obstetrics, pediatrics, and geriatrics, in today's session, we are going to discuss about the kangaroo mother care. The kangaroo mother care is for the low birth weight babies. It was introduced in Colombia in 1979. So we know that the kangaroo mother care is given for the low birth weight babies. It was given for the low birth weight babies. We know low birth weight baby are the babies who are weighing less than 2.5 kgs. It is given to the low birth weight babies, and it was started in Colombia in 19 it was started in Colombia in 1979. It was introduced by Dr. Hector Martinez and Edzar Ray in response to the high infections and the mortality rates. So we know that the low birth weight babies will have high infection rates, and also the mortality rate is quite high in them. We know in India 18% of them fall under the low birth weight babies. So the mortality rate, the death rate in these low birth weight babies is very high. In response to the higher infection rates and the mortality rates, Dr. Hector Martinez and Edzar Ray started this kangaroo mother care. It is essential for ensuring the best care for the low birth weight babies. It is a best option for the care of the low birth weight babies. What are the four components? So, what does this kangaroo mother care contain? The kangaroo mother care comprises of the skin to skin positioning of the baby on the mother's chest. So, you can see in the picture here, there is skin to skin contact between the mother and the baby. So we see that the skin to skin contact of the baby is done with the mother by positioning the baby on the mother's chest. Secondly, adequate nutrition through the breastfeeding. So we know that the babies are adequately fed by the mother. The breastfeeding is done adequately by this kangaroo mother care. Next component of kangaroo mother care is to provide the ambulatory care because of earlier discharges from the hospital. So, ambulatory care, what do you mean by ambulatory? Ambulatory care is the care which is provided on outpatient basis. Okay. So the earlier, it helps in earlier discharge from the hospital, and the treatment or the further things can be carried out on the outpatient basis. Ambulatory care because of the earlier discharge from the hospital can occur with the help of this kangaroo mother care. Lastly, we also support the mother and the family in taking care of the baby. That is, you can teach the mother the methods of breastfeeding. If the baby cannot suck, you have to teach the mother for the nasal catheter, and all such, how to hold the baby, how to understand the cues of the baby, and breastfeed the baby, how to take care of the baby has to be taught to the mother and the family, so that the best care of the low birth weight babies can take place. So let us revise again what are the four components, or in total let us summarize. So the kangaroo mother care. So the kangaroo mother care was especially given for the low birth weight babies. So we'll revise here. Okay. So the kangaroo mother care is given for the low birth weight babies who are weighing less than 2.5 kgs, and we see that it was started in Colombia in the year 1979. Who started it? Dr. Hector, right? Dr. Hector Martinez, and along with him Edward Ray started this kangaroo mother care. Why did they start? In response to the higher infections, because of the higher infections and the mortality rate of this low birth weight babies. And there were four components. What are the four components? First one is the skin to skin contact. Second, the adequate breastfeeding can be done. Third, we saw that ambulatory care, the mother can be discharged early from the hospital, and the ambulatory care outpatient basis they can carry on the further treatment. And fourth, last, we saw that they will support the mother as well as the family in taking care of the baby. So this was all about the kangaroo mother care. I hope everything is clear. If you like the video, hit the like button and subscribe. Thank you. Yeah, the last thing was the MCQs. We didn't look into the MCQs. MCQs, guys, we have two MCQs. The underlined part in each of the videos are the MCQs. So if we miss out the MCQs, always remember the underlined part, what we study, the underlined things are the questions which we find in the NEET pre-PG previous year papers. So the skin to skin positioning of the baby on the mother's chest is the kangaroo mother care. The other component, adequate nutrition through breastfeeding, can be done with the help of kangaroo mother care. Okay. So we know that adequate nutrition through breastfeeding, the adequate nutrition can be given to the baby through breastfeeding, and skin to skin positioning of the baby on the mother's chest is done. So this was all about the kangaroo mother care and the MCQs. I hope it's clear, and you can put the doubts in the comment section.